You might have been told a million different things about your PCOS, but the truth is, it's really just a result of your insulin resistance. Insulin resistance is not merely a symptom, but a fundamental driver of PCOS. Now we have these powerful GLP1 medications like semaglutide and tirzepatide that reduce insulin resistance and promote massive weight loss. These are the absolute best things that you need to do if you are suffering with PCOS. If you don't address your PCOS now and handle those infertility issues, you may miss out on one of the many joys of life. So take this journey with me so that you may, once and for all, handle your PCOS and restore your quality of life. My name is Dr. Jones, and I've been helping women just like you for the past 20 years, both when I was managing gyms with hundreds of trainers and thousands of clients, and now in a clinical setting, and so many women with PCOS. And I've done it both with focusing on insulin resistance and without. And trust me when I say this, we have to incorporate insulin resistance as part of the protocol. So what's it like dealing with PCOS? When people ask me, I have this little example, right? So we're talking about weight loss, we're talking about making improvements in your health. We know the more overweight you are, the more obese you are, the more difficult it is to lose weight. Okay. So being a 200-pound woman with PCOS to me is like treating a 260-pound woman who is desiring the same outcome, who's desiring the same goals here to lose weight, to improve metabolic health. Yes, the woman with PCOS has many other symptoms, but at the end of the day, the issue that the way that we approach it here with the weight loss, with the improvements in the insulin resistance, it's the same thing. But with this issue, with this condition, PCOS, we have to try a lot harder. Insulin resistance tends to be a lot higher, and we're going to get into all of that. So first off, what exactly is PCOS? Polycystic Ovarian Syndrome. And I think the medical system just has it completely misunderstood. It really is a very difficult condition to dissect. So let's look at some of these symptoms here. Mood changes, acne, insulin resistance, weight loss resistance, fatigue, increases in male hormones, infertility, alterations in your menstrual cycle, irregular hair growth, of course, the growths on our ovaries. And so, yeah, it's real nasty. It's real frustrating for especially young women. And I think the biggest concern and scare, and understandably so, is infertility. Am I going to be able to have a kid? Well, when you have PCOS, many women become infertile. So this is a big deal, and we want to get in front of this as soon as we possibly can. We want to beat this and handle this, and there's a really powerful way that we can do that. So the current healthcare system, unfortunately, like many times, it's sort of stuck in this tunnel vision where they're looking at symptoms. We're looking at symptoms, we're chasing down symptoms. So the big issue with PCOS, like we were saying, is the increased androgens, the increased testosterone. And so women are suffering with this body hair growth and acne as far as the day-to-day sort of symptoms. And so many practitioners are out there putting them on medications like finasteride or spironolactone, which ultimately are going to do their thing as far as decreasing the conversion to certain androgens like DHT, dihydrotestosterone, which really is the most potent male androgen. It's a derivative of testosterone and will be responsible directly for causing a lot of these side effects. And so, yes, we can do that. We can chase that hormone with a drug, but we have to think of this and take a step back and look at PCOS and all these hormones, testosterone, DHT, DHEA. These are symptoms. These are like leaves on a tree. And if we trace that tree down to the trunk, to the base, what's the root cause? And this is where it gets interesting. This is where it gets controversial. Well, depending on who you talk to. For me, it's like I've seen so many women get better over the past 20 years and working with other clinicians who are on the same page and see the same thing. It's always been insulin resistance for us. But it's interesting, right? Because that last chart, we saw insulin resistance as a symptom. But is it a symptom or is it a cause? And truthfully, at my core, I can tell you insulin resistance and really hyperinsulinemia, which is essentially chronically elevated insulin levels. Truthfully, that is the cause of PCOS. Insulin resistance is just the most common cause of hyperinsulinemia. elevated insulin levels. But at the end of it, so we focus a lot on fixing, because to fix the elevated insulin levels, we have to fix the insulin resistance. But at the end of the day, it's the higher levels of insulin that these women have that cause the whole cascade of varying effects. So let's go over to this. Let's dive into some of these different categories here, really connecting the dots here. So hormonal imbalances, androgen production, insulin resistance is always leading to elevated insulin levels. It stimulates the ovaries to produce those androgens. So it comes from the insulin. High levels of androgens are the hallmarks, right? We talked about the various symptoms of PCOS and the various issues like hirsutism, acne, irregular menstrual cycles. It's the elevated insulin in the bloodstream that will actually, in some cases, even alter sex hormone binding globulin, which is the hormone that, or the compound, the globulin that binds to testosterone, that binds to these hormones. And so, as you can see in the study, has a dramatic impact. Research suggests that both genetic predisposition and environmental factors contribute to the development of PCOS. So, insulin resistance is always seen in women with PCOS, and even regardless of their BMI, which is very interesting. But in most cases, we're going to see women with PCOS, elevated insulin levels, obesity, difficulty losing weight, right? But we have some other hallmarks. I do believe there is a genetic driver to this, and we're going to talk more about that later. When we dive into the pathophysiology, when we dive into what's actually happening here, we realize it's a complex interplay between metabolic and reproductive dysfunctions, but the chronically elevated insulin levels are exacerbating the hyperandrogenism, the elevated male hormones. And I shouldn't say male because women have them too, but higher to the degree of which males have them is what we're referring to, and why women with this condition are struggling with these symptoms. It impairs the development of our follicles. It leads to the lack of ovulation and formation of these cysts. So, many practitioners think that it's these, unknown reason, these cysts on the ovaries that are, and they're not really cysts, they're the fluid-filled sacs, but in any case, it's the dysfunctional ovaries that's leading to the change in your hormones, which then leads to the insulin resistance. But that's not actually the case. It's actually a side effect. It's a result of this cascade of interplay of various things going on. So clinical studies have demonstrated that improving insulin resistance through lifestyle interventions, and we're going to get into a lot of it, through medications like metformin, that's usually a common medication that's given. GLP1 medications, I think, are the best tool, and we're going to get into that here in a little bit. Give women good relief, give them improvement. But at the end of the day, lifestyle interventions are always going to be the most powerful thing. But as we can see here in the study, there's a lot of evidence. There's a lot of evidence to support that lifestyle interventions that focus on lowering insulin levels are going to have a positive impact. By improving insulin sensitivity, which is what's happening when we're lowering those insulin levels, the production of androgens can be reduced, which will lead to improvement in fertility, which will lead to improvement in these symptoms that women are dealing with. Okay, so I think it's important that we understand the relationship between insulin, because we're talking about elevated insulin levels, and what causes that, what leads down that path, because the solution centers around that, hopefully, as you can tell by this point. So insulin is a hormone that's responsible for storing nutrients. We think of insulin as the blood sugar, hormone, right? It controls blood sugar, but it does so much more. Insulin actually is storing sugar, glucose, as well as protein and as well as fat. So it is a storage hormone. That's what insulin does. And so insulin is secreted in most cases in response to when you eat food, because we want to get that food after it enters our bloodstream, after digestion, we want to get it into the body. So it's the effects of insulin that allow this to happen. But there is a situation that takes place where our body begins to develop resistance to the effects of insulin. And so, again, normally, to just kind of give you a good visual of this, you eat food, blood sugar rises, insulin rises, then the blood sugar goes down, then the insulin levels go down. We call those transient rises. But over time, and we'll talk about the why in a second, but over time, this resistance develops, okay? And so the body has to do whatever it possibly can to keep the blood sugars down, because high blood sugar levels can eventually kill you. And so, not a good thing. So what the body will do is, its only thing it can do is release more insulin. So now it takes more insulin to get the job done, more insulin to get the job done. And if the resistance is getting worse, your body will keep making more insulin. Meanwhile, the entire time your blood sugars look fine. Your A1C looks fine. A1C stands for glycosylated hemoglobin, which is essentially a marker that when we look at that, when it was tested, shows us the average of your blood glucose for the prior 90 days. Very powerful marker. But for many, many, many years, before the A1C ever rises, your insulin levels are rising, specifically fasted insulin levels. So you can check this by doing a fasted insulin and C peptide test. If you're curious, if you're down this pathway towards insulin resistance, which ultimately leads to prediabetes and all sorts of other various conditions, including PCOS. So we have to understand this relationship. So the resistance sets in and your body is producing more and more insulin to get the job done. But what caused the resistance? And there's many theories behind this, but my personal opinion and strong belief that, and I think it isn't just one answer. I do think there's many components to this. And I think genetics is one of them. But I truthfully think that the biggest driver behind the insulin resistance is the chronically elevated insulin levels, the hyperinsulinemia. So it is the fact that you start creating that. So I know it gets really confusing because you're like, wait a minute, if it's the high insulin levels that create the resistance, but the resistance creates the high levels, what was the initial starting point? And the only thing that could start the process of elevating one of those things, right? Because it takes the elevated insulin levels to start the resistance, which then makes the elevated insulin levels worse. Your only thing you could do before you're resistant to elevate insulin levels is your lifestyle. And specifically, when we look at macronutrients and we break it down, we have 3 different macronutrients. We have calories, we have fat, and we have protein. Fat is going to have a very negligible effect on insulin. Protein will have moderate, but moderately low, and carbohydrates will have a high impact on insulin levels. And if we break down the category of carbohydrates, we can say healthy fruit and vegetable, moderate glycemic carbohydrates are going to have lower in the category of carbohydrates. And then as we start moving up to higher glycemic and then ultimately processed and refined carbohydrates, processed foods are going to have the worst impact and have the highest amount of insulin response. And so it's our diet. It's our diet that led us down this path of developing, of creating environments where insulin levels are always elevated. And so it hits us with this reaction from the body where it has to develop resistance. And why it develops resistance, well, that's a whole nother conversation for another video. But long story short, this is actually a thing that we would want our body to do. The ability for your body to adapt and cope and maintain homeostasis and maintain balance is something that we see all the time. Your body develops resistance to drugs that it's exposed to at a high level over a long period of time. Your body develops resistance to hormones as well. I mean, look at bacteria. Bacteria are developing and evolving to develop a resistance to antibiotics. So it's not just a human thing. Personally, it's in my opinion a instinctual and intrinsic driving factor at the basis of survival, right? You won't survive as a species or at all if you don't have an ability to cope and adapt. And this is a powerful adapting mechanism. Unfortunately, it's working against us in this situation. And now we have this problem called insulin resistance, and that's perpetuating chronically elevated insulin levels. And that's why you have your PCOS. And by the way, it's not just a PCOS issue. Even if you don't have PCOS, if you have metabolic derangement, if you have obesity, diabetes, a lot of these issues, they're all coming at, in my opinion, as the biggest driver behind this is the chronically elevated insulin levels. I wanted to interrupt for a quick minute and let you guys know about the permanent weight loss guide that I've created for you guys. I'll link to it in the description. It
covers 3 of the most common roadblocks that people encounter on their weight loss journeys. Number 1, weight loss plateaus, how to bust through them. Number 2, how to start a prolonged fasting regimen, but do it safely and do it correctly to optimize results. And then finally, medication independence, specifically semaglutide, tirzepatide. If you're looking to save the most amount of money, this guide and this program will help you wean off of it. I'll link to it again at the end of the video here in the notes. And now back to the show.
Now, I just want to add how you eat, what you eat is a big piece, the biggest piece. But there are other issues too as well. The biggest one would be elevated cortisol levels. And so we have to give that cortisol its respect. Elevated cortisol level, chronically elevated cortisol levels, which are normally usually caused by the chronic stress, maybe lack of quality sleep too as well, will drive cortisol levels to be higher. And with elevated cortisol levels, you will have increased releases of blood sugar, increased releases of glucose. And now we have the same problem despite what we're eating. So outside of a situation like that, it ultimately can be, and in many cases, it could be both. It's what we're eating. It's when we're eating. Okay. So hands down, the most important strategy would be changing our dietary approaches. All right. Now, before we even get into that more, let's talk about the big bad GLP-1 medications, semaglutide, tirzepatide. So I'm such a fan of these medications because they are so freaking powerful at accomplishing what we need to accomplish for not just you suffering with PCOS, but for people that are metabolically broken and deranged and down the path towards diabetes and obesity and many other issues. These medications immediately will improve insulin resistance. It will improving insulin resistance means decreasing insulin resistance, which is also the same thing as saying improving insulin sensitivity. Just want to be clear. It also shuts down food chatter. It decreases your hunger. It decreases food chatter. And the combination of both produce this amazing fat loss component, this result in fat loss, this result in weight loss. But also, it opens up the door to lifestyle intervention, to lifestyle improvement. Many of you are watching this thinking, I've been there, I've done that, I've really tried. I know some of you are lazy, and I'm not trying to call anybody out, but I think you could do that for yourself here. Some of you haven't really tried, but for some of you out there, you really have, and you really have been sort of like, a football player running into a brick wall, like you, a lot of force, a lot of energy, but you ain't going to break through that brick wall. And that brick wall is the food chatter. That brick wall is your body's resistance, right? This food chatter is a component, a side effect, if you will, of the body's desire to maintain its weight. We call this concept the weight set point theory. Your body's trying to keep you at a certain weight, and it's usually almost always chronically elevated insulin levels that are driving that signal. And so it increases your hunger, it increases your cravings, it can screw with your metabolism too as well. I have many other videos where I talk about that. But at the end of the day, giving us this portal of entry, smashing the doors open so that we can push our way through, that's what these medications do. And so I'm a big fan. And I think for women with PCOS, if you remember what I said earlier, it's 200-pound woman with PCOS, you're like a 260, 300-pound woman, meaning you have much more resistance, but nothing changes. So even though you are here dealing with all these unique symptoms, some of them very, very bad, like infertility, we still just need to keep ourselves grounded here. We don't need to worry about what do I do about these side effects. I mean, you can worry about them, but what I'm saying is you bring it back to the base and you focus and truly dive headfirst into fixing the real problem, which is elevated insulin levels, chronically elevated insulin levels, or hyperinsulinemia. So this is what we do with our patients all the time. Remember, I have clinics we surface across the nation for lasting weight loss, and a good majority of our patients that are in our program are women just like you suffering with PCOS. So nothing really changes. We use the GLP-1 medications as a tool to implement better lifestyle changes. Now, the other piece that I'm a big fan of is getting into some aggressive fat mobilizing support. And this is where I get into peptides like AOD 9604 or samorelin, tesamorelin. These are growth hormone secretagogues. AOD is actually 9604 is a fragment of growth hormone. So what these peptides do is mobilize body fat. I like to call them artificially induced metabolic flexibility in a bottle.
And we need that in the beginning if you're suffering with PCOS, because you have a great deal of resistance, you have a higher level of inflammation. And so we need as much help and support as we can. The combination of both really does produce a phenomenal sweet spot for us. And then we dive into the lifestyle. And hands down, when we look at the diet, because diet's always first, we reduce our consumption of processed foods and we replace that, keep our protein intake high. Your protein intake, a simple formula is your total weight and your target weight. You want to be consuming within that range of that many grams of protein per day. So if you're 200 and you're trying to weigh 150 to 200 grams of protein, that's the ideal protein range. But when it comes to the rest of what we're eating, which is carbohydrates and fat, we're reducing our consumption of fat, of carbohydrates, and in having to replace that with healthy fats, because inevitably you're going to get enough saturated fat without even trying. So we have to put emphasis on healthy fats. This is our mono and polyunsaturated categories. And there's not a ton of foods. This is, I can give you the list right now. This is small fish, olives, most nuts. I'm not a fan of peanuts, but most nuts, and avocados. And then, of course, we have olive oil and avocado oil. So getting a lot of healthy fats along our good solid amount of protein and keeping our carbohydrates low. And then overall, eating less processed foods, because it's the processed foods, even the unprocessed carbohydrates, but like processed meats, for example, that bring a lot of inflammation, that bring a lot of chemicals and toxic exposure to the body, which will drive this process, which will also contribute to insulin resistance. Inflammation and insulin resistance are very much different things, but they both go hand in hand. The more insulin resistant you become, the more elevated your insulin levels are, the more inflamed you become. The more inflamed you become, the more resistant you become. So we could focus on just one thing, but ideally, I've seen better results from doing things in both compartments that will bring down insulin resistance, lower those elevated insulin levels, and also bring down the inflammation too as well. And then the third thing that kind of goes hand in hand with those things is our metabolic flexibility. Our body's ability to tap into fat sources alongside carbohydrate sources is something that we've all lost if you've never done any sort of lower carb or fasting protocol and you have extra body weight in your body. Your body's never going in a fat burning situation. The only way you can be metabolically flexible if you're not fasting or doing low carb is if you're very insulin sensitive and you're at a healthy body weight, and then your body is keeping a balance by alternating between the carbs and burning them when you eat them, and storing fat and tapping into your fat. That would be the only exception. But for everybody watching this video, that's not us, right? We're not in that situation. So we have extra body fat. We have a lot of body fat. We're struggling with PCOS. And again, it's getting a grip of these of those insulin levels. And so getting back to the base of how we fix them with lifestyle, we have the nutrition part. Now, I would say the equally as important, probably, I mean, I go back and forth because this is the one that always gets people. But I think fasting is hands down one of the most important things someone with PCOS should be doing. And we're talking so much more than intermittent fasting. Intermittent fasting is great. Look, intermittent fasting, this is your daily eating, your daily consumption of calories, first calories in, last calories in. We call that your eating window, and every 24-hour period, compressing that to like 8 hours. That's great. It's not going to move the needle. It's not going to be enough for you if you're suffering with PCOS. But we can get into longer fasting, also known as prolonged fasting. So what I've created is the FLOA protocol, FLOA, fasting like our ancestors. This is the world's most aggressive and structured approach towards prolonged fasting. What I did is I figured out the longest fast duration that an individual can likely do in a given week, and repeat that on a weekly basis without getting the metabolic downregulation. Because if we fast for too long of a period, or if we fast too frequently, we can get that metabolic downregulation. And if you guys are curious about how that works, the weight loss plateau, I have a phenomenal video you guys should check out where I dive into weight loss plateaus. So we avoid that by not pushing it too much. And what I've found as the greatest degree is that 24 to 48 hour range every single week. Intermittent fasting on the other days. We talked about the nutrition, and then finally throwing in some resistance training. This is so important because your muscles are like sponges for glucose. And when we lift weights, improving insulin sensitivity improves muscle mass too as well. So we know this. We know how important muscle mass is for improving metabolic outcome and improving overall effects of our efforts within the category of exercise. Resistance training is always going to play a huge role. I want to mention a few more categories because they're also important. If you're suffering with high levels of inflammation, for example, you have an autoimmune disease as well, or you have some other inflammatory condition, PCOS, we already know is inflammatory driven as well. And so we got to get in front of that and doing everything we can to reduce our inflammation levels. And so I'm a big fan of this powerful, it's called naltrexone, but in the anti-aging space, they refer to it as low dose naltrexone. And it's a usage of it where it's significantly lower than its FDA approved dose. And what this little thing does is it powerfully modulates the immune system and reduces inflammation. And so I'm all for science. I'm all for safe support if we combine it with proper lifestyle so that we can get the best possible results. So LDN, your nutrition, and supplements, and that's going to be the next category, are going to be the ways that we can drive down our inflammation. So within the supplement category, just being consistent. I have plenty of other videos where I spend a ton of time getting into all that, but covering our basics of nutrition, of our nutritional needs, magnesium, vitamin D, essential fatty acids with fish oil. These are all important, but we want to drive inflammation down. Curcumin, which is from turmeric, and resveratrol. These are going to make powerful reductions in our inflammation as well. And then just being consistent. AM morning supplement routine, PM supplement routine. The combination of this and just being consistent ensures that our body is always getting support that it needs, the adequate micronutrient support. Macronutrients is our calories, protein, and fat, but micronutrients refers to our vitamins, minerals, antioxidants, and all those things that don't have caloric value that are still required for life. And then finally, and certainly not least, getting control of our sleep and getting control of our stress. Plenty of videos where I dive deep into these on the YouTube page. And so that's it. If we get these things in place, if we embrace science, in my opinion, GLP1s, fat mobilizing peptides, LDN, you don't get a stronger combination other than those three things, in my opinion. But still, you need to pair them with lifestyle so that you guys can get the best results. We'll see you guys later. If you guys enjoyed this video, I want you to check out this video over here called GLP-1 Realities. It's an awesome interview that I did where I got into the program that we're talking about here, the FLOA protocol, and how we help patients just like you with PCOS deal with lasting weight loss issues. Please watch and enjoy, and we'll see you guys later.